Mastering Squat Pivot Transfer, a step-by-step guide from a bed to wheelchair. Today, I'm going to guide you through a squat pivot transfer from the bed to the wheelchair using a gait belt. This technique is particularly useful for safely assisting your loved one, especially as mobility becomes more challenging due to ALS. Let's break it down step by step. First, let's make sure the wheelchair is correctly positioned. You'll want it right next to the bed, at a slight angle for an easier transfer. Ensure the wheelchair seat and bed are at the same height. Always check that the wheelchair brakes are locked to keep it stationary. For optimal transferring, lift away the arm of the wheelchair closest to the patient. This allows the patient to slide onto the wheelchair seat without standing. Next, we'll use the gait belt. When placing the gait belt around your loved one's waist, ensure it's snug but comfortable. Avoid positioning it over sensitive areas or medical devices. If you need assistance learning how to place the gait belt, check under the Assistive Technology tab on this website for instructional video. Have your loved ones sit at the edge of the bed, with their feet flat on the floor. Pull their feet at an angle in front of the wheelchair as far as possible. As the caregiver, position yourself in front of them, feet shoulder-width apart, to maintain stability. Bend your knees slightly, keeping your back straight to avoid strain. Instruct your loved one to lean forward slightly and use their hands to push off from the bed as much as they are able, reaching for the arm of the wheelchair. At the same time, you'll hold on to the gait belt, lifting from your legs, not your back. This coordinated effort helps in lifting them up into a squatting position. Once they're slightly lifted, both of you will pivot together toward the wheelchair. Keep the movement smooth and controlled. Then, gently lower them into the wheelchair seat. Lastly, make sure they are comfortably seated and properly positioned in the wheelchair. Their feet should be on the footplates and their back against the chair. Pull the armrest back down and lock it into place. Once properly seated, remove the gait belt. It's essential throughout this process to maintain constant communication with your loved one. Ask for their feedback, how they're feeling, and if they're comfortable. Your confidence and reassurance can make a big difference in how safe and secure they feel during the transfer. With practice, the squat pivot transfer can be performed smoothly, enhancing mobility and confidence for both caregivers and loved ones. Mastering the squat pivot transfer technique not only ensures safety, but also promotes dignity and comfort for those we care for. Learn more about this and other techniques on knowals.com. Thank you for watching.